Hello, everyone. Good evening to all of you. I'm Rathi from Bladder Wellness Team. I'm sure all of you must be keeping good in health. Today, we are going to discuss a very important topic, that is benign prostatic hyperplasia, which is also called as BPPH. Benign prostatic hyperplasia, BPH, is the non-cancerous enlargement of the prostate usually begin in the 50s in men and which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night and is the most troublesome aspect of this condition as it makes them tired during the day, having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor such as urologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's the right for diagnosis and treatment of BPPH, today we have with us renowned urologist Dr. Arun Rathi, MS, MCH Urology. He has experience of 3+ years and is an expert in the field of Endourology Laparoscopy Lasers Sexual Health. He has worked at some elite hospitals like Care Hospital, Banjara Hills, and currently practicing at SN Superspeciality and Wellness Erramanzil. Dr. Arun Rathi has rich experience in the field of urology and carries out diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. So today we have Dr. Rathi over here. Doctor, we have questions regarding BPH as we all the viewers are willing to know all the advices today we have. So what is BPPH?
Thank you for the introduction. See, benign prostatic hyperplasia, it is an aging phenomenon. Generally, prostate enlarges after the age of 50. Okay, so it is an aging phenomenon. The prostate gland, it is present near the bladder neck and it surrounds the urethra. So when, as the aging phenomenon, as the prostate increases in size, it causes compression of the urethra and causes few symptoms like storage symptoms and obstructive symptoms. Okay, like storage symptoms, patient will experience nocturia. It means waking up in the night more than once to pass urine. They will have urgency, they will have frequency, and they'll have obstructive symptoms like intermittency, poor stream, incomplete evacuation, difficulty in starting urination. So these all symptoms are related to BPH. It is a non-cancerous condition. It is generally related to advancing age.
Doctor, what are the main causes of BPH?
No, as I told you, it is an aging phenomenon. As the age increases, there is a growth in the smooth muscle as well as the connective tissue in the prostate. No, that causes enlargement of the prostate gland.
Can it be seen in the middle age group, as in like 30s or 35s, since it's a
No, no. See, prostate doesn't increase before the age of 40. It is very rare. Before the age of 40, there is a bladder neck dysfunction. Prostate usually starts to enlarge after the age of 40, 45, but it doesn't give symptoms until it is what we say that until there is an altered ecotexture of the prostate causing obstruction. Even there is no relation between the grade of the prostate and symptoms. Even a small prostate can cause symptoms, or even a big prostate may not cause symptoms.
doctor, as it is said, it may occur in most of the 50s the men's who turns 50. Is it probability that all the men causes the BPH, or it's just very few cases?
No, see, with age as prostate increases in size, not all men every increase in prostate gland gives symptoms to everyone. Only few people suffer from the symptoms of prostate. As I told you, there is an altered echogenicity or altered altered ecotexture of the prostate. If there is more fibrotic component increase in the prostate or repeated infections in the prostate, that leads to symptoms. Routine increase in prostate need not cause symptoms in everyone.
So, what are some of these symptoms associated with BPH?
Yeah, as I told you, the first symptom associated with prostate enlargement is nocturia, increase in frequency of urination in night, waking up in the middle of the sleep to urinate more than once.
What are the
And there is
symptoms?
like other symptoms like urgency. Patient may have like hesitancy, poor stream, unable to start urinary stream, unable to maintain a good stream, unable to evacuate completely from the bladder, incomplete evacuation. So these all are the symptoms of prostatitis.
Doctor, what precaution should be taken while turning the age of 48, 49 to avoid BPH?
See, once you are having a BPS, what you can do is you can take measures to prevent UTA.
Hmm.
Make sure that you don't get any urinary tract infection. Keep your diabetes in control. Maintain a healthy lifestyle. Weight loss is also needed. These all symptoms help a little bit in well-being of the individual.
What are the most troublesome symptoms which are being caused in men in the age of 50?
For these patients, as I told you, nocturia, waking up in the night for more than one or twice, it disturbs their sleep. If there is no sleep, they are not active the other day. So it causes poor quality of life. Leaking in the public because of the urgency, unable to control urination, peeing for long periods. It can be an embarrassment in the public. So these all things cause people to suffer.
Doctor, what are the different diagnoses of lower urinary tract that symptoms are seen in men's?
Yeah, there are storage symptoms and obstructive symptoms. Storage symptoms are like urgency, nocturia, frequency, and obstructive symptoms are they associated with the urinary stream, thin stream, intermittency, incomplete evacuation. All these things are.
So, doctor, how is BPH severity quantified?
Sorry.
How do we get to know that a person has a severity in BPH?
See, there is IPSS scoring, International Prostate Symptom Score, which has like 0 to 35 parameters. Depending on the symptoms which I told you, like frequency, urgency, nocturia, and obstructive symptoms, we give an IPSS scoring depending on the severity is mild, moderate, and severe.
We have some questions is there anything we can do to prevent BPH from developing or worsening? This is one of our viewers' question. That is Amitesh Mishra. He has a question. Is there anything we can do to prevent BPH from developing or worsening?
No, see, there is nothing to that which we can prevent from developing. Yeah, we can prevent it from worsening.
Hmm.
There are few medical medications present, alpha blockers, which prevent the progression of disease by adding an alpha 5 alpha reductase inhibitor. So there are few drugs which can prevent the worsening, but we can't prevent the aging phenomenon.
Okay. What tests are recommended for men with symptoms suggesting BPH?
One is like regular ultrasound abdomen, prostate size, pre-wide and pre-VR, like uroflowmetry to see the how is his obstructive pattern is there or not, and to see serum creatinine if any changes in the kidneys is there because of the high residual urine due to prostate. These are the basic investigations to be done. And a prostate-specific antigen, serum PSA, which is related to prostate, which gives us the diagnosis of any infection, malignancy, or benign condition.
Doctor, how should BPH severity guide to be managed?
How come?
How should BPH severity should be managed? Like if it's very
No.
severe, how should we manage?
See, first, as I told you, for any prostate enlargement causing symptoms, we give a medical trial. Medical trial is like cinnabarine or alpha blocker tamsulosin. This we give a trial. If patient is not improving on the medical trial, then we prefer for surgery, endoscopic surgery. It is a non-surgery. Endoscopically, we go for removal of the prostate. It can be enucleation. It can be because of. It can be with the help of a laser or monopolar or bipolar. Different techniques are there. So first, always it is a medical management. If patient is not satisfied on the medical management, or if medical management is not working, if the syllabus in whatever you are prescribing, if it is not working, then only we go for surgical intervention.
Doctor, which medical therapies are effective in management of BPH?
There are two classes of drugs. One is alpha blockers and 5 alpha reductase inhibitors. Alpha blockers help in prevention in improving the flow and all. 5 alpha reductase inhibitors helps in decreasing the prostate gland size. Generally, it is said that if you take for 6 months to 1 year, there is only decreasing 20% of the gland size. But there is a risk of side effects with the help of 5 alpha reductase inhibitors. Hence, we generally used to prefer only alpha blocker. Alpha blocker also, as I told you, the combination like sinodosine, tamsulosin, alfuzosin, different varieties of.
Doctor, which patient should be referred for surgery and which patient should be referred for therapies?
See, if patient is, there are few indications where we directly go for surgery without waiting for medical management. And what are those conditions if patient is having recurrent UTI, more than 3 episodes in a year? If the patient is having acute prostatitis, prostate infection, if the patient is having bladder stone, urinary bladder stone, and if the patient is having upper tract, any kidney changes because of the prostate, the kidney changes also occur. If patient is having all these changes, and if patient is having intractable bleeding in urine because of the prostate infection, then we straight away go for surgery. If these symptoms are not there, then we manage it medical management.
Okay. What are the long-term risk of BPH?
See, long-term risk of BPH as such, as I told you, when we go for surgery, like having recurrent bleeding, recurrent infection, changes in the kidneys, raising creatinine, high post-void residue of urine, urinary bladder becoming hypotonic, for bladder stones, leading to bladder stone formation, leading to urinary retention. These all things can happen.
Doctor, what are some of the treatments available for BPH except for surgeries and therapies? Do medications work on BPH?
Yes, definitely they work. And our first line management should be medicines only. In medicines, as I told you, alpha blocker are there, which we prescribe. And we assess the improvement of the patient on his symptom scoring on ultrasound to see PVR is increased or improved or not, and uroflowmetry to see if Qmax value has increased or not.
We have viewers having questions regarding the same. Can
Yeah.
lifestyle changes help manage BPH systems? That is a question for one of our viewers, Arham.
Yeah, recently a few articles have come up which show that regular yoga, meditation, healthy lifestyle, weight loss, exercise, these all lead to the helping prevention of aging phenomenon related due to prostate. Whatever changes to occur in prostate, these things can prevent.
Okay, doctor, we have one more viewers having questions. Ankit, can BPH lead to prostate cancer?
No, prostate cancer is differently other entity. Prostate BPH is another entity. There are two ends. Okay, BPH cannot lead to cancer.
We have Bhavesh also. often should we have a follow-up appointment if they have BPH?
No, once a preliminary investigations have been done, if the patient is put on alpha blocker, we assess for improvement in less than a month. If the patient is improved on the alpha blocker, then we ask him for follow-up every 6 months, 6 months to 1 year.
So what are the doctor? What are the symptoms that show up in the age of is there is a urinary increasing like frequent day? What are the number of times a person might urine during the day if they are facing BPH and they don't know how it can be? What are the diagnoses of BPH? So what are the symptoms that we need to frequently remember if causal mens?
See, as I told you, first symptom of the BPH is nocturia, increase in nighttime frequency. Increase in daytime frequency can be because of many other issues also, like overactive bladder, patient anxious person, repeatedly going to washroom to evacuate himself before starting any other thing. So daytime frequency doesn't matter much. Which matters is nocturnal frequency and obstructive symptoms.
Uh, Doctor, do other diagnoses such as obesity, diabetes, or any other diagnosis being treated, does BPH affect mood if the person is in 50s?
Yeah, see, obesity, whenever there is a weight loss, it definitely improves the quality of life and even in the urination. Having obesity sometimes can have an overactive bladder, patient having more frequency, adding to the frequency because of the prostate.
Doctor, what are the major causes of having a BPH? Like apart from the symptoms we noted, if we do not have a regular lifestyle, do BPH causes severe?
No, the severity of BPH is urinary retention. The patient may land into urinary retention. That is the only severity. And if it is neglected for a long period of time, it can lead to renal changes, kidney changes.
Uh, Doctor, do all the men's age up to 50 should get their self checked treated for BPH?
No, not required. After the age of 50 years, if they are having symptoms, then only we need to evaluate for BPH. Yeah, but after the age of 50, we need to evaluate serum PSA, prostate specific antigen, which is related to prostate cancer. After the age of 50, if we repeat once, it is good enough because it is a screen test. We can pick up the cancer in early stage.
Doctor, what are the prior precautions to be taken care to avoid BPH? Like before turning 50, if we take any precautions furthermore at the age of 40s or 45, what are those precautions and it should be taken care of to avoid
There are no,
BPH?
no, as I told you, the BPH is an aging phenomenon. There are no precautions which we can take to avoid it. And every BPH doesn't cause symptoms. Most even if the prostate enlargement is there, you may not experience symptoms. Only those patients who are experiencing symptoms, we treat.
Do we have types of BPH?
No, there is nothing in terms of BPH.
Okay.
Like,
Uh, are there any medications that can help BPH to increase the severity? We have a viewer's questions. That is Rohit, who wants to
no,
know.
so the medications, as I told you, 5 alpha reductase dutasteride, it is a medication which can decrease the prostate size, but it has to be taken for long term, like 6 months. That then it decreases only 20%. And there are side effects of the drug, like loss of libido, gynecomastia. There are quite side effects, hence people don't prefer for long-term medication of 5 alpha reductase.
Doctor, we have one more viewer asking the questions. That is Shreyansh. How long do BPH symptoms typically last?
No, the symptoms last. If the patient is symptomatic, he will be symptomatic until he is treated, either by medication or by surgery. If you are not treating, then the symptoms will present. They won't subside by themselves.
Okay. Thank you, doctor. Thank you so much for advising all the viewers. And also, we have a lot of viewers asking questions regarding the same. And same, we have Adi Jain. Is surgery always necessary for BPH, or are there any alternative treatments?
No, surgery is not required for every BPH. As I told you, only if there is repeated infection, if there is urinary retention, if there is formation of stones in the bladder, or if there is kidney damage, then only we go for surgery.
Doctor, we have one more viewer, that is Ajay. Can BPH affect his sleep pattern and quality of sleep?
Yeah, definitely. If patient is having symptoms because of prostate, then his night there will be increased frequency in night, which will hinder his sleep, and next day he won't be active.
Uh, does a BPH need to see a urologist who is in like turning 50 directly? Do men's need to see a urologist?
Yeah, I would advise because urologists are the one who can evaluate properly whether the symptoms are related to prostate or not, and if the prostate is enlarged or not. They might be suffering some other medication, some other disease, and unnecessarily they might be put on other medications of prostate. So it's always better to meet an expert who is in well versed in the prostate health.
How long lasting are the effects of the procedure if the
See,
treatment goes?
yeah, if the patient is going for surgery, if you go for laser, which we do, thulium laser, thulium fiber laser enucleation, the patient we remove complete blood through the urinary tract. So patients for 15-20 years, they will be asymptomatic.
Doctor, what are the potential risk of the procedure?
98% it is the safe procedure. Any surgery has 1 to 2% complication of bleeding and infection, which can happen with anyone.
How aggressive
99%.
should be one way with the treatment?
No, you don't need to be aggressive with the prostate treatment. Patients should be managed on alpha blockers. Many of the patients do well on the alpha blockers for even 5 years, 10 years, 15 years. Only when the medication is not working or if the patient is having complications related to BPH, then only we go for surgery. In then he should be managed on medication.
Do all the urologists suggest medications, therapies, or the surgery, or it depends on what criteria they fall in?
Yeah, as I told you, if there are no complications, we prefer medication. If there are complications, we go for surgery.
And which are suggested for therapies?
Which medical management you are asking?
No, no, no. Any patients with 15s with having BPH, do doctors suggest therapies? Because there are a lot of men who are scared of.
No, no. As I told you, not every prostate enlargement will give you symptoms. Only those prostate which are giving symptoms we treat. Not every BPH ultrasound showing grade 1 prostate, grade 2 prostate need not be treated. That is a routine aging phenomenon.
Okay. Okay, thank you, doctor. We have more viewers with more questions, and that is Rehan Khan. Can BPH cause erectile dysfunction or other sexual problems?
No, BPH doesn't cause any symptoms, but medications which we treat to prevent the BPH or symptoms, they cause retrograde ejaculation.
We have Rohan Punawala. Can BPH affect his urinary incontinence or lead to bladder control issues?
Yeah, as I told you, patient can experience urge incontinence. His bladder can have those spasms and can lead to incontinence due to prostate.
What are the four factors that contribute to BPH?
The increase in pathologically, as I told you, increase in the muscle mass, the fibrotic component, increasing gland size. They all lead to prostate enlargement.
How is BPH measured?
The different grading systems, generally we measure through the ultrasonography. Normal volume is around 10 to 20 cc. How much it is enlarged, it is measured through the ultrasonography.
What is the most important risk factor for BPH?
Family history,
Okay.
genetics, the rest all it is nothing significant.
But what diet BPH?
Diet, you meant to say diet.
Diet, like food and
There is no specific diet.
uh,
All the other dietary things are under trial, but there is no specific diet approved for prostate.
what are the warnings? Like, what are the severity signs of BPH that all men should take care of?
Yeah, difficulty in urination, increasing frequency of urination, bleeding in urine, decrease in flow of urine. These all things they need to be cautious and attend as soon as possible to look at the urologist.
How is a BP? What is the BPH normal range?
10 to 20 cc, as I told you.
So we have viewers' questions that is like sort of can BPH worsen exciting existing kidney problems or lead to new kidney issues?
Yeah, see, prostate symptoms can lead to retention of urine, which can further damage kidney, which is already damaged. That is the reason we need to treat the prostate. Any infection in prostate can damage still kidneys.
What is BPH information for patients? Like lots of men do not know about BPH. So what should be informative for them in their daily lifestyle to avoid?
See, they just need to focus on the type of stream they are passing, any frequency, any urgency, all those things. They need to focus on that. If any symptoms are there, they need to meet the local doctor, local urologist. There is nothing major problem in it. Just they will be evaluated and they will be put on a medical management. That should be sufficient for them. Ignoring the problem will lead to complications.
We have Chetan Bandarkar. Question is, can BPH affect his mental health or contribute to symptoms like anxiety or depression?
Yeah, see, if patient is leaking in public, if patient is unable to hold urine in the public, definitely he will feel embarrassment and it will affect his mental health.
Doctor, we have Raju with us, and his question is, how long do BPH symptoms typically last?
If once patient is symptomatic, he will have symptoms unless you treat medically or surgically. They don't subside on themselves.
Uh, Doctor, according to the medical terms, the prostate is about a size of what kind, so that patients should actually know
It
about
is
it.
the size of a walnut.
Okay, it's a size of a walnut. Okay. Uh, we have Suresh Kumar with us. How often should they have a follow-up appointment if someone has a BPH?
Every 6 months and 1 year, they should be under follow.
What suggestions would you like to give to the men who are turning 50s and if they are having BPH? So what suggest and advice you would like to
I,
give them?
I would suggest to get a routine ultrasound done. Visit your urologist, get a rectal examination done to see if there is any nodule in the prostate and a uroflowmetry done. So that they will have a basic evaluation of the prostate health.
Are prostate problems common in men's in their age of their 30s?
No,
Symptoms of enlarged prostate are what are the symptoms of enlarged prostate?
I told you frequency, nocturia, urgency, urgent incontinence.
Doctor, what are the preventions that one must take care of? Like if they have already faced BPH and they have taken a complete treatment, once the treatment is completed, can they stop their medication?
No, patient can't stop medication because as prostate is an aging phenomenon, either he should be on medical management or he will land in surgery. There is no other alternative.
Doctor, do BPH cause inflation to some of the areas of the body?
No, it doesn't cause.
Does BPH cause bladder to weaken or strengthen? These are the
Yes, yes. Yeah, see, if prostate obstruction is there and if you are not voiding properly, bladder will get weak. And over the period of time, if bladder gets completely weakened, even if you treat prostate, there will be no improvement in the urinary bladder flow. Hence, early diagnosis and treatment should be must.
Doctor, there are some questions which are related to, you said there were like two prostatic and state 5. What are like stages of BPH?
For the stages of BPH,
BPH, yes.
no, there are grading. Grading of BPH is there depending on the volume of the gland size, increasing gland size. We grade like grade 1, 2, 3, 4.
Doctor, you said about 5 alpha radiocast. Can you elaborate more about it?
Yeah, 5 alpha reductase inhibitors, they decrease the, generally what they do is they help in preventing the testosterone conversion to dihydrotestosterone, which is a potent stimulator of BPH. So by giving that, they decrease the testosterone levels, because of which the gland size decrease, and because the testosterone levels are decreased, the patient has side effects like gynecomastia, breast enlargement, loss of libido. So hence we don't prescribe more than 6 months to 1 year.
So once BPH is treated fully, a person should properly take care of their diet, their hygiene, and that is how they have to take care, or they
Yeah.
can just completely stop once it is not shown that yes, they are not affected by BPH anymore.
No, they can be affected later. They have to maintain the healthy lifestyle. They're
Okay.
not affected now doesn't mean they won't be affected later. They can be get affected any point of time after the age of 50.
So after taking proper medications and treatment being completed, all the men have to take care of their diet, their hygiene. They have to maintain the healthy lifestyle to avoid furthermore intake of
Yeah.
BPH. Yeah. So, doctor, what advices would you like to give to all our viewers, all the preventions and causes to maintain their diet and a healthy lifestyle?
See, as I told you, first is weight loss, second is exercise, third is yoga, and fourth is early diagnosis and treatment. Don't hesitate if you are suffering from any urinary issues, visit your urologist, let him evaluate, and get treated before it's too late.
Thank you so much, Dr. Arun Rathi, for your valuable time, and it has been quite very informative sessions for all our viewers. We look forward for many more such sessions in the coming time. Thank you, viewers, for your
Thank
excellent
you.
participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead
Thank
and
you.
take care of yourself. Thank you so much.
Thank you.